I am the Director of Communications and Campaign Planning, and I'm joined by Phil Noyes, the Senior Policy Analyst for Voices for Healthy Kids. You'll get to meet Phil in a moment. But today, just a few housekeeping notes. Please note that this call is being recorded, and for those who aren't able to make it today, but just disconnect if that's an issue for you. If you have any technical issues or questions during the call, you can chat directly with our colleague Yui, who's listed as tech support in the attendee list. Thanks, Yui. We ask that you participate fully in the event, take part in the polls, engage in the breakout rooms and ask questions. These trainings are always better when you're fully part of them. I know breakout rooms sometimes make people nervous and they tend to scatter, but please don't. We appreciate it and the call will be better for it. So thanks for the help. And we'll have a Q&A session at the end, but we encourage you to add any questions into the chat box as we go along. Today at Voices for Healthy Kids, we use the Power Prism Advocacy Framework created by my Power people. And the Power Prism framework is a step-by-step plan that helps you recognize and act on opportunities to build momentum in a campaign for change. Today, we're really going to focus on the research and data, which is one of the power tools of the Power Prism framework. So trainings on the Power Prism overall, as well as deep dives into those 6 power tools that are part of it, are available on our website, and we'll be having more coming up. So at the end of the session, there'll be time for questions, as I said, but please add them to the chat as we go along. And now a quick poll, our first poll of the day. Please let us know about your experience in using data to support advocacy campaigns. This will help us cater some of the info for today and follow up on the needs of the group. And you can share the results with everybody as they come in. Great. And I think you can see those live results. So I'm quickly going to go over just some of the building blocks that we put into campaigns, because I think it's important as an overall setting for today's call. The first step of building power for your advocacy is really answering 3 key questions. It's the thing we do whenever we look at any aspect in the Power Prism or any advocacy campaign. Everything in your campaign should be informed and guided by your answers, including research and data. So the key questions, it's tempting to want to jump right into methods and strategies, but winning policy change campaigns are those that are guided by these 3 key questions. What do you want? So what's the policy change you're seeking to address your issue? Why do you want it? What data make a case for that policy change? And who has the power to give it to you? Which specific decision makers in state or local government have the power to make that change? The answer to these questions can change throughout a campaign, so it's helpful to get into the habit of visiting them regularly. Whenever I'm doing a large part of a campaign or thinking through a new strategy, I always go back to these 3 key questions. And once you have those answers, it's time to then come up with the strategies for each power tool that will influence those decision makers. So again, today we're going to focus on learning more about research and data resources. For any policy campaign, it's essential to present data that defines the problem, the populations that are impacted, and science to support your policy solution. Without data that explains the problem and justifies the solution, a proposed policy lacks the credibility it needs and is unlikely to gain support of decision makers. The great news is that your campaign has access to a large body of research and data through Voices for Healthy Kids. While all 6 power tools in the Power Prism model shown here are super important, the only one that must come first and must never stop is research and data collection. And now I think I'm going to go through 2 more slides and then turn it over to my friend Phil. So we can really think about research and data collection as falling into 2 broad buckets: research that helps express the change that you want to make, and research on the decision makers. We call the research on the decision makers nuanced research. Although we'll not be covering this directly in this training, we wanted to note it. The research is often less formal and may happen over time, but it's important to understand the decision maker that you're trying to target and what makes them tick. The second one is direct research. So that's the hard data, the science, the evidence-based practices, the objective facts. So what data explains the need for the change you're trying to promote? What is the formal process and timeline for making such a change? What has already been done in a community? What scientific and anecdotal data explains the potential impact and the return on investment? So I'm going to turn it over to Phil now. Phil.
Great. Thanks so much, Allyson. And that was a great intro and great kind of overview of what we're going to talk about today. So I want to highlight a couple of resources that we have available, and I believe that Yui did share the fast facts. We've got fast facts on maternal, infant, and toddler health that was recently updated. It was updated November 2021. And what these fast facts do is they really take research and translate it into kind of bite-sized bits, talking points, things that you can use to support your campaigns. We understand that often, during your campaigns, you're required to quickly take information that is out there in the research field and make it so it's digestible and understandable to policymakers as well as constituents. So that's what we're trying to do with fast facts, is really make it so that they're really easy for you to get to and utilize. And then next slide, Yui. So I think the next thing that we want to do is go ahead and just ask you, in terms of using data in your work, how do you currently use it, and or how would you like to be using data more in the future? Are you looking to use it more in terms of really identifying what the policy priorities should be and who may be most impacted? Or are you using it to really demonstrate need with policymakers, or demonstrate need with residents, expanding your coalition and expanding kind of the group you're working with? So if you could go ahead and respond to that poll, that would be great. All right. Great. So 75% are using it really in terms of thinking about policymakers. It's interesting in terms of so few people thinking about using data to demonstrate need of expanding their coalition. And as Allyson, the first step really should be thinking about what policy priorities and who may be most impacted, and all of those areas are great places to be using data. Go ahead and do the next slide, please, Yui. So what we want to focus in on today is trying to bring together both data and stories, because we feel like this is your way to really make a big impact on the people that you're trying to influence. This is a favorite quote of mine from our Chief Medical Officer, Dr. Edward Sanchez. Data make you credible, stories make you memorable. So in the past year, we really have been exploring how that we can help advocates do this better, how we can bring together both data and storytelling. So Yui, go ahead and provide the next slide, please. And so we've been working with this platform called My Sidewalk, and this is a resource that we can make available to you. And what My Sidewalk does, and I believe you received the link for the library, and it's also in the chat. My Sidewalk brings together existing data, so data from the census, data from the CDC, as well as being able to handle data that we bring in. And it puts it in a platform in which all the data is geocoded. It's all spatially related, so that not only can you understand what the data says, say nationally, but you can zero into the location or the area that you're most interested in. And depending upon the data source, you know, it can get down to a really small geographic area. So we can be, you know, potentially down as small as the census tract. But as you'll see, we'll be looking at some legislative districts. So you can develop data specifically where you're specifically reporting out based upon, say, your state Senate district. And this is a way that we feel like is really effective in terms of helping tell a story, but tell a story that's most interesting to the population that you're trying to reach, either the elected official or community groups that potentially are impacted. So what we're going to do is take that fast facts data. Go ahead, next slide, please, Yui. And we're going to marry that or bring that together with the My Sidewalk platform. And this is just a quick view, and we're going to kind of dig into this a little bit more deeply in just a minute. But you'll have a link that you can go ahead and start to look around and play around with. And this link is best to open in Chrome. And depending upon your internet speed, it may take a little while for it to upload. But what we've done is we've provided a little bit of an example of how we can bring these different resources together. So bringing the talking points of the fast facts, and then bringing in the data, and we'll show you the different levels of data that we're potentially looking at to then you know, tell a story. And I'm going to hand it back to Allyson, and she's going to show you not only can we develop these reports that exist, you know, on the internet, but we can also use these parts of these reports to develop social media posts and really try to bring attention to. So, Allyson.
Great. I think what's really exciting is, you know, when I was running campaigns myself in the field is I didn't have as easy access to the data that's available in My Sidewalk. I certainly didn't have it at all the legislative districts that we can get it now. But even when I had it, I didn't necessarily always know exactly what to do with it or how to make it user-friendly. And translating that data into user-friendly tools and graphics is an incredibly great way to be able to share this information both with decision makers as well as with members of the public or board members or anyone else that you have to sort of sell the concepts to. And so I took, and I know you have a link to this, there was one done on sugar drinks in the District of Columbia, and I took those last night and translated those very simply in 15 minutes into 3 really cool graphics that we're able to share. Voices can help you do this as well, and we'll get into our resources later, but you have access to the data, and now is the time to share it. To access to these reports allows you to easily download the data and graphics to share as a whole or to take snippets and personalize it to your audience. Here, there's just something I made up about World Diabetes Day. The graphics with those numbers are actually just a download right from the report that I was able to put into this post, and then add specific things around the Nutrition Equity Act, which is something that they're working on. But you could do this just educationally, you could do it in lots of ways. So everything I'm sharing here is just samples of what's possible. If we go to the next slide, and I think then you can start at UE. This is an example of district level data that can be used to target in this case, city councilors, but I would share this, I would tag those councilors on social media, and what it is really demonstrating the difference in life expectancy at birth from 2 different wards in the district. And you know, these are a little more, you know, they move a little, they get people's attention. So I think it's super helpful to use tactics like this that outline what the differences are for people, what the data is, and then make it as personal as possible for people. And the next one is just a Facebook post that I was able to do. I was able to pull the amount of dollars that would have been raised from this right from the the My Sidewalk report and the Fast Fact report that Phil was talking about. So I knew how much money was going to be raised, and I was able to put it in sort of really fast acting Facebook post. So just a few examples of ways that you can turn data into something that's helpful and exciting. Phil.
Thanks for that, Allison. That is fantastic. And now what we're going to do is go ahead and look at the report a little bit more so that I can kind of walk you through it. I'm going to go ahead and share my screen and then just walk you through the report. All right, you should be all be able to see it at this point. And I do want to say this is a fine time for you to go ahead and jump off mute if you've got a question or if there's something that you want kind of more clarity on. As Allison pointed out, we're intentionally showing you kind of rough drafts. Like, these are not finished products that we're showing you. We're showing you a tool that allows you to bring these data points together and these visualizations together in a very quick way that then you could really refine. But we wanted to keep it rough, and we want you in the small group to really kind of poke and probe at it and think about, oh, what you would want to do differently, what you're most interested in. Are there any questions right now before I kind of just walk through this process a little bit? Okay, so I'm showing you the My Sidewalk data report. As Allison showed, you can go ahead and take the different parts of the report, and you're able to create a social media post, or you're able to create a separate graphic. And all we've done here is we've taken the fast facts, and then we've started to add some visualizations to it. So in terms of like the first fast fact, is all about the importance of the early years. So in this report, we're focused on Florida, and we're recognizing that Florida has real low rates of prenatal care in the first trimester for pregnant parents. And so we can do a little graphic on it. We could go ahead and look at this nationally, and then look to see what the rates are in Florida. We could see what the surrounding states are. We can also compare it to states or areas in the country where you're seeing a much lower rate. And then we can look at prenatal care by race, ethnicity, and be comparing that Florida to the country, or whatever other groups that you want to look at. Then we can kind of zoom in. We can say, okay, we're not just interested in the state as a whole. We actually want to look at the counties, and we want to see, where it is that has the lowest rates of prenatal care. The other thing to say with this data here is we're seeing a lot of areas with no data. So that's a sign in it of itself in terms of like where the data is missing. We did the same type of thing in terms of preterm birth. We can be looking at it by state. We can be looking at it by race, ethnicity, and then again by county, and kind of so on and so forth. This is one way to be thinking about comparing infant mortality rates and getting a different ways to present and look at data that may be really compelling to policymakers. So within this one report, we then have linked other reports so that you can segment out. You can kind of create little chapters to the stories that you want to tell. And here we're looking at lifelong impact in terms of the early childhood experience and how that can impact chronic health, chronic disease over the life course. So looking at, say, high blood pressure, like what we saw before, we can look at high blood pressure by county, but we can also look at it, by state senate district. And so you can develop a report specifically for the state senator that you're speaking with, and you can show them the data for their particular area. We're looking at the same type of thing for diabetes. These have not loaded up yet, so let me see if I can refresh those and get those to load up properly. So those are some of the tools that we have, using the My Sidewalk platform. Here we can even, there's been research which has translated the cases of diabetes to direct medical costs and indirect medical costs. And so you could build an argument to support your campaign around that. So that's our quick kind of overview in terms of the My Sidewalk data report. Yui, can you pull the slides back up? Thank you. And actually, we'll jump back one, and I just want to use our the last slide, which is really kind of posing the question, where the sidewalk ends. What would you like to do? How can we build this together with you? What do you think would be kind of most helpful? So before we jump into the small group discussion, I wanted to give a little bit of space and just see if there are any questions or comments that people want to make in terms of some of the resources that we've talked about so far. All right. If not, Yui, I will hand it over to you to break us out into small groups, please.
Sure. Thanks, Phil. So we really want to hear from you. This is a tool that can be customized to your needs. And so we have a really painless breakout group session for you today. And the instructions are simple. Let me move forward. So one, we have a little note-taking tool here. Just note which group that you end up in. And so the Google Drive or Google folder is in the chat, and the specific rooms document that you're in. We're just going to ask you a few questions. First, introduce yourselves, assign a scribe and someone who's going to report out, and answer some of these questions, including looking at the sample reports. Is this format helpful? What do you like or don't like about it? What data do you need access to? And then what's the best format to receive the data? Is it electronically with the URL like Phil demonstrated, or is it a printed version or something like a PDF? And do you like full reports or data snippets? So that's what we're going to do. And it seems like we had some drop-offs. So let me rearrange real quick and we'll send you out. All right, here we go. All right, everyone, welcome back. Hope the breakout rooms went well, and we're just going to do a quick report back. And so if you assigned a person to report out, could I have someone from room 2 just share some big takeaways or just kind of summarize some of the conversations you had?
And Yui, I think I was in room 2. And of course, you know, me being in room 2 means that I didn't fully follow the directions. So I will take that on myself and be the person to report out. And others jump in if they have questions. We had a couple of really interesting questions in terms of thinking about what was available by data and really wanting to kind of talk through more of the resources that voices can provide. And I think Allyson's going to touch on that at the end of the presentation, but I do want to kind of jump in there and say, right now we are trying to really give away technical assistance. So this is not something in which we're looking to collect any fees or anything like that. We very much want to make data more accessible, and we want to help build the skills and the capacity to support policy change. So that's my editorial report out. Other folks in group 2, any questions or additional comments that I missed?
All right, thanks. Group 2, looks like I give you a thumbs up. Allyson, who from your group is going to report out?
Shocking, it's going to be me. No one would step up once they knew I'd already had to talk. So you'll have to listen to me for a few more minutes. But we had a really interesting conversation. I think some of the basics about the formats is that people like the visuals and the infographics because they're more, they can be easier to work with and more palatable, but having some flexibility in how you get data so that you can use it in lots of different ways. We talked a little bit about some of the issues with what we're data that we have access to now, meaning it's really hard sometimes to find the gaps, especially if we're talking about eligibility but who's eligible but maybe not accessing subsidized childcare, for example. We're still hearing from people who are able to access, not those who aren't connected. So we're not getting to the folks through traditional data means. So we're thinking about that. Sometimes data for infant and toddlers is kind of thrown in together, or it's thrown in together with all kids and sort of doesn't tell this real story of babies and the need for babies there. So we need to do some work around there. We also talked a little bit about people not thinking of babies as people with rights. So figuring out once we even have good data, how we use that to change mindsets. And then we talked a little bit about more about lumping it together, babies versus preschoolers and what that means. When we see the data, it may look okay overall, but for babies, it's really not good. And for preschoolers, it might be a little bit better, but figuring out how to separate that out is important. Yeah, and then we did talk about when you make data look pretty in little snippets, sometimes that's what people grab onto on either side of an issue, and sometimes that isn't necessarily make it the strongest data point or the most important data point. So thinking about that as you build things and as you look at what people on the other side are saying as well. Yeah, thank you. But anyone else from group 3, step up.
Yeah, anyone else from group 3? No, I think that was a great summary, Allyson. And I'm actually going to pass it back to you and share my screen for a bit of wrap up. Let's see.
Yeah, so I think, why don't I go through some of this stuff since some of these questions came up and then we can do questions after I do. So if you want to go to the next slide. I think it's important just so you know that Knowing which individual decision makers specifically have the power to give you what you need is critical. This allows you to utilize all the power tools to influence those decision makers to support your goals. But remember that this research and data collection work takes time, and through it, you're building a strong platform for the rest of your campaign. So, you know, it's all really good work put in, even though it can seem like you're spending a lot of time in your own head and on the computer. It's super important, and probably we need to do more of it at the beginning of our campaigns and continuing throughout our work. If we want to, I just want to let people know the research services we provide. We do polling and message research help. So if you're doing any polling on your own or any message research, we can help you design those and give you access to kind of work that we've done in the past. Or if you are interested in message research or polling that's been done in other places, you can reach out to us and we can see what we have to supply you. We do science review. As you saw with those FastFacts, all of those go through a very rigorous science review process through AHA. We are a research-based organization, so that's super important. So we can help take science that you want to use, but you want to make sure that it's been reviewed rigorously. We can do that for you and make sure it has sort of that AHA approval on it. Pulling in local data for your campaign. Ask us about My Sidewalk, a new data platform where we operate that helps us use data to tell your campaign story. We can help you access that and pull that data. The types of information we can pull are local data by census tract, zip codes, in some cases legislator districts as well. And all of this is free to access through our TA portal. Some of the other if I get into resources and success stories, your campaign may need to get its hands on some community level data in a way that will garner media attention and lawmaker interest. We can help you with that. We can help turning these into, whether it's snippets like infographics or really good success stories or media advocacy placements. We have experts on staff that can help you do that. Again, you get us through the TA portal. The technical assistance areas that we provide are around coalition and community engagement, decision maker advocacy, fundraising and development, equity and inclusion, legal review, media advocacy, national partner engagement, offline and online grassroots. We can help develop policy language. We can review language. Again, I said the polling and the focus groups and other message research technical assistance. If you're doing your own community informed research and need some help there, we can offer some expertise, science review, subject matter expertise, training and capacity building, and translation services. And I'll say, and more. So if you need it, let us know and we'll see what we can do. And then the last thing I just want to talk about is the Policy Research Network is here to help. We have this Policy Research Network of experts to help. It was formed in 2014. It's comprised of 40 members, all of whom have research expertise in issues aligned with Voices for Healthy Kids policy agenda. They have regular exposure to Voices campaigns in the field to help spot research needs and opportunities. And they're a great resource for us if we come across a research need or a data need to go to ask if they know where to find it, or if they've seen anything about it, or if that research needs to be done, figuring out ways to go from there. We also have done a tremendous lift over the last few years to really diversify the Policy Research Network so that we're making sure that we're reaching all members of our community, especially those most impacted by the issues we're trying to change. So if you want to access any of our technical assistants, our staff, any of our resources, the place to go is voicesforhealthykids.org. If you go up into the right-hand corner, you'll see there's campaign resources, there's grant applications, there's a resource library, sort of, and that'll drive you either to the resource that you can get yourself or a link to our TA portal where you can just put in what you need and someone will get back to you. And sort of that's our sort of wrap up on resources and TA that we have, but I think we have some time for questions and answers, which I think Phil is going to help mediate for us.
Sure. Yeah. Thank you for that, Allyson. I think I'm glad that you were able to include all that, because really we are trying to set ourselves up to be a resource to advocates. So questions about that follow-up, or questions about the data or about the My Sidewalk platform, the floor is open. Any questions or anything else you want us to cover? Okay, well, we can wrap it up, but I feel like there's a question out there since you all have been dedicated and stayed the course with us. So last call for that. All right. Well, if not, thank you so much for your time. This has been great, and feel free to reach out via the TA portal or otherwise. Thank you.
Thank you.